Hi guys, this will be my take 2 of my methods section of the research project. If you guys don't know already, I am one of 3 in the Ankle Consortium group with Megan and Brian, and my focus of this project will be on the relationship between patient-rated outcome scores and functional assessment tools. So the purpose and the specific aim of this portion of the project is to determine the relationship between functional tools and self-perceived function in patients with chronic ankle instability. We'll be using 4 different PROs and 4 different functional assessment tools. So the PROs we'll be using 4 different domains. We'll be using the lower extremity functional scale, which will be testing the lower extremity as a broad domain. We'll be using the foot and ankle ability measure quick version, which will test just regional. We'll be using the disablement of the physically active scale, or the DPA, and that will be testing global perception of well-being. And finally, we'll be using the Tampa scale of kinesiophobia, version 11, to test kinesiophobia instead of the psychological portion of an injury. The 4 different clinician-rated outcome scores we're using are the functional assessment tools. We're using 2 for testing dynamic stability of the ankle, and we're using 2 for looking at landing kinematics. So the 2 for dynamic stability, we're using, the first one will be the triple hop for distance, which will test the strength and power of the lower extremity. And then we'll be using the single leg figure 8, which will test speed and agility of one leg. The landing system, or the landing kinematics, will be tested using the landing error scoring system, the LESS, which tests landing kinematics on both legs, and the single leg landing task, which tests landing on one leg. Overall, with me and Brian and Megan, we will have 3 30-minute sessions, with each session being no less than 24 hours in between, and all 3 sessions will be completed within a 2-week time span. Our participants will range from age 18 to 60. They will recruited from here on ISU's campus. We will not just recruit from the recreation center or the athletic training room. We do plan to send out campus-wide social media announcements, as well as setting up tables and booths at the Commons, which is like the central hub of the campus. Each person will have to will have to be physically active. And they'll either be in the chronic ankle instability group or the healthy group. So we'll have 20 participants for the chronic ankle instability group and 20 for the healthy group. When they first get into their session, they both have to take the first session will be, of course, consent, and then it will follow with taking the Cumberland Ankle Instability tool and the Ankle Instability Index, which are 2 tools or 2 questionnaires that test functionality of the ankle. And both groups will take that, which will further validate that the healthy group is healthy and the chronic ankle instability group is in the chronic ankle instability group. However, the healthy group will not be doing the PROs. Because of the ceiling effect, these PROs are not meant for healthy individuals. They'll just be checking off. We find that will just diminish our results, and so we've decided just to do the patient-rated outcome scores with just the chronic ankle instability group. The healthy group will be tested bilaterally, and the chronic ankle instability group will be tested unilaterally, with the one that scores lower on the ankle instability index and the CATE, the Cumberland Ankle Instability tool, whichever leg tests lower, will be the one that we test. So when we look at that, that is basically how our methods are going to go. We're going to have randomized order for the 3 groups. We're going to make sure that we don't have an overlap. So what that means is, for session 1, we'll have the informed consent, but in session 2, they're not just going to have functional tools and strength measures, which is another part of the project. So we're going to make sure that fatigue is going to be as limited as possible, and that'll also help with the amount of rest that we're giving them, which will be dependent on patient need. The PROs will be done once, and the clinician-rated outcome scores will all be done 3 times, and the average will be taken, whether that be score for something like the single leg figure 8, or time for the single leg figure 8, or distance like the triple hop for distance. I hope this clarifies a lot of stuff. We definitely, me and my group, have been working really, really hard to kind of nail down our methods, and so we really feel like these are solid, and we're really excited to hopefully begin, and maybe once we get our IRB in at the end of this month, that is our goal. So I can't wait to hear about y'all's, and best of luck.